Helpful hints for using the SCOE Ultrasling ER post-op brace following shoulder surgery. So Jake, you're using the Ultrasling 15-degree ER post-op brace, and we want to go through a few questions to help people understand living with the brace. So first of all, can you show us how you've got it set up with the pillow and the straps and everything?
Sure. One portion of the brace is there is an external rotation pillow that is adjacent to the body and keeps your arm 15 degrees externally rotated in the position we'd like it after surgery. Some other features of the brace include an over-the-shoulder strap that has an armhole, and then an around-the-waist strap to keep everything secure to your body.
So really two straps, and the one over the shoulder has a extra strap. The one goes above and one below to balance the weight so it doesn't pinch you or cut into your neck.
That's right.
But also that strap is important because it maintains a harness on your shoulder to keep the arm portion of the sling from migrating around, because you want to have it at your side as you're showing us here. And that's important because it keeps the arm away from the side to allow a little air circulation under your arm, and also keep the arm in external rotation to avoid developing internal rotation contracture. And how long do we need to have our patients wear that pillow?
The pillow will stay in place for 2 weeks after surgery.
Sometimes, of course, if the tendon is really bad or some instability cases, we'll leave it a little longer, but 2 weeks is about right. And how often during the day does the patient need to wear that?
So the sling will stay in place with the pillow when you are sleeping, when you're up moving around the house, or when you're moving around outside of the house. You can remove the sling to do your exercises as instructed, to bathe, or while you're resting in a seated position.
So, in other words, sitting at the computer or sitting at the dinner table, it's okay to have the sling off.
Or sitting watching TV, yes.
Yeah. And the whole purpose is to remind you not to stress your shoulder and the stitches inside your shoulder till the body's had a chance to really start the repair. And in a few weeks also, it won't be as risky to develop what we call a contracture or scar tissue in the front of the shoulder. So holding it a little externally rotated is the best way to avoid that. So what about the ball in the front of the pillow there?
So we've conveniently placed a ball just in reach of your hand. The ball can also be removed from the pouch. We'd like you to, as frequently as you're able, to give the ball a good squeeze with your operative hand. And that'll keep all the joints and muscles in your hand and wrist more loose, as opposed to getting stiff while they're in the sling.
So when we take the pillow out at either 2 or 3 weeks, whichever is requested by the surgeon, show me how to do that.
So there's a couple things you want to do first. The first thing is to remove the thumb strap. The second is to remove the arm strap. And then you have to disconnect the over the shoulder strap and remove it from your arm. And then secondarily disconnect the around the waist strap here. And then you're free. Remove your arm from the sling at that point. And then you need to do 2 different things in order to remove the pillow. The first of which is to disconnect the Velcro on the very front and then pull the sling away from the pillow. It's important to recognize that we've left the strip of Velcro that's very coarse and can rub against your body on the pillow that will be going away. After we've done that, we then need to rearrange the strap that goes through the front 2 hitches here. And we will simply pull it free of one, pull it through the other, and then stick it down. so that both of those straps are free.
So that exposes the two D-rings, and it's necessary to have both exposed so that the shoulder strap will have a place to fit.
That's right. And so when we put it over our shoulder, we have one piece of equipment remaining that needs to be removed, and that is the clip, and that will simply slide off of the strap.
So we remove the buckle on the over the shoulder strap.
And then lastly, we will feed the strap through both of the D-rings on the sling, like so, and bring it up and around to be reattached with the Velcro at the end of the strap.
So the Y-tab that used to hold the clip in place now holds the sling neck strap back up after passing through the D-rings.
That's right.
Okay.
You're good.
But you leave the shoulder harness in position again to spread the weight of the arm evenly over the shoulder and not have any compression. And one last thing, Jake, can you tell me when you take the sling off to do the exercises, what's the best way to take it off?
The best way is to do one of two things. Either disconnect the front strap or simply loosen it and slide out of the sling. You can do either, they both work the same, and then remove your arm to do your hand, wrist, and elbow exercises.
And at a week or so post-op, at the post-op appointment, the doctor may ask you to do pendulum exercises. So, of course, when you do that, you take your arm out of the sling and do those exercises.
You allow your arm to hang and then move it back and forth as is comfortable, forward and backward, and around in a circle.
Thanks very much, Jake.